It's believed 1 in 10 American women suffer from endometriosis, but even with that being common, it's still hard to get a diagnosis. March is all about raising awareness on this disease, and in-depth reporter Alicia Nespresso brings us the story of one Belton mom who struggles with it every day.
Anita Hancock has been dealing with pain throughout her body for years.
I'm in chronic pain, I'm in pain every day.
After visiting dozens of doctors who were unable to help, she finally found a specialist who confirmed what she already knew. She was dealing with a common disease among women called endometriosis.
It's a sense of relief, but it's still a battle because you still have it's still those hurdles, because although you have that specialist that validated, that there's something going on in your body, but, that they can't take care of all of those things.
Hancock says she didn't feel she was being heard with most of her doctors. Even after she had the diagnosis, she says they still wouldn't treat her or acknowledge the disease at all.
These doctors, they make you feel like it's in your head. I've had them throw depression medication at me and say that, you're exasperating the pain that you're feeling.
Endometriosis is when a woman's uterus inner lining tissue grows on the outside. It can bring a wide range of symptoms and severity, making it hard to diagnose.
The reason why some people get diagnosed after so long is that the presentation can be so varied and the severity can be so varied. It's like, oh, I have a little bit of stomach pain. Oh, I'm struggling with fertility, or oh, I have another issue. So I think that that's why so many women struggle with what's wrong.
Some women have constant pain all over their bodies, which can get worse during their cycles and even cause infertility. But symptoms can also be as subtle as nausea, acne, or asthma.
Every woman's story with it can be varied, but again, very common, benign, but the presentation of the symptoms can be anywhere from mild to severe.
The Endometriosis Association labeled March as Endometriosis Awareness Month back in 1993 to inform the public more about the disease.
Because society conditions us to not take this seriously, sometimes women and girls don't, and they actually are jeopardizing their own future. I'm not blaming them. I'm just saying we have to find a way to counter this social conditioning.
Mary Lou Ballweg is the president and executive director of the association. She says her whole purpose is to raise awareness.
3/4 of the women in our research registry were told by physicians that their symptoms were psychological. So it's such a very strange thing, considering that there are many, many, many physical symptoms.
She says especially young women can be impacted when their pain or symptoms are not being taken seriously.
Well, the younger they are, the more susceptible to a loss of self-confidence, a loss in their own belief to be able to read their own body, a loss of willingness to share the symptoms.
Hancock says her mental health was also compromised after not being taken seriously. She now encourages other women to stand up for themselves.
Keep fighting for yourself. Do research, find a doctor that's going to listen.
In Belton, Alicia Nespresso, KRHD News.